Germany has posted a massive spike in COVID-19 cases with more than 6,500 new infections in a 24-hour period. Let's have a look at how quickly new infections have surged in the past 7 days. We were at 2,828 cases last Wednesday. That was October the 8th. The numbers then kept rising, and there's a bit of a dip here on the weekend when not all local health departments report numbers. And then you'll see the steep rise to where we are today at 6,638 newly registered COVID-19 infections, with numbers more than doubling in 1 week. It means the virus is growing exponentially. And the figures come just hours after Chancellor Angela Merkel met with the leaders of Germany's 16 federal states to agree new unified measures to slow the spread of the virus.
Once seen as a role model for Europe, Germany now feels the pandemic is getting out of hand. Though the country has fared relatively well so far, with cases rapidly rising, Angela Merkel has issued a stern warning. If you ask what worries me, then it is the exponential rise, and we must stop it, otherwise it will not end well. We can see that all over the place, and I don't need to look at Germany here. I only need to look in the neighboring countries. That's the point. Regional leaders have agreed to shut hospitality venues from 11 p.m. in areas should they become virus hotspots, a regulation already adopted by some cities like Berlin and Frankfurt. Contact restrictions will also be enforced in hotspots. Social gatherings will be limited to 10 people from a maximum of 2 households, in a bid to curb the number of infections. At the political level, one bone of contention remains. Leaders can't agree on domestic travel rules that mean travelers from hotspots cannot stay in hotels without a recent negative test. The accommodation ban is still contested among the states. Some want to keep it up at any cost. The majority of states are skeptical because it's relatively inefficient to prevent infections. But in the end, it causes a lot of agitation, anger and disruption. But some on the streets say it's not more rules that are needed. The existing rules are not being followed and they're not being enforced. All too often, you see people without a mask on buses and subways. I believe the rules should be better executed. It's a fine line. When you see all the weddings, you can of course understand, but on the other hand, it's also a risk for others, as well as for the elderly. I think we all need to be reasonable. If the number of infections keep rising, Angela Merkel has warned that even tougher steps may be needed.
Well, that report by DW political correspondent Emmanuel Schaz, who joins us now from our parliamentary studios. Emma, what's behind these rising infection numbers then?
Which leads obviously to more positives as well. You have to know that since mid-August we've been seeing here more than 1 million tests being carried weekly. Also, there's a backlog. Several laboratories warned that they were starting to be overwhelmed, that there was that backlog as they are reaching their testing capacity limit. Now, the number of daily infections here in Germany, you've stated, that it reached the level of March with more than 6,600 infections daily. This is alarming, but in comparison to neighbouring countries, Germany still fares much better. For example, neighbouring France accounts for more than 20,000 daily infections. The Czech Republic yesterday counted more than 9,500 infections for a country whose population is 8 times less than that of Germany. So yes, the hotspots and infection rates, 400,000 inhabitants, increase exponentially, and it is worrying, but Germany still has a better handle of the pandemic than its neighbours so far.
Well, we just heard about the new measures that Chancellor Merkel and the 16 state premiers agreed upon, but Merkel reportedly said she was not happy with the results. Why?
She would have wished for stricter measures. So we've seen in the report not all state premiers agree, for example, on the accommodation ban in various regions. So there still needs to be talks between the state premiers and the Chancellor regarding domestic travel. So those are all the reasons why those negotiations took so long. There were marathon negotiations over 8 hours into late at night yesterday. And Angela Merkel had warned time and again that people need to keep being careful, keep wearing masks, keep respecting social distancing, and she's reportedly also quite annoyed by the fact that not everyone seems to be observing all the rules.
So what is the plan then if Germany does not get the infection rate back under control?
Well, if those new measures don't suffice, then we can very well imagine that we can see in the future more localized lockdowns, firmer lockdowns being put into place. The thing is that the government and the regions want to avoid stricter lockdowns simply because also this would actually be another blow to the German economy. And Angela Merkel actually warned that Germany simply couldn't afford another meltdown of its economy.
DW's Emmanuel Schaz talking to me a little earlier. Poland is also expected to announce new restrictions after registering a record of nearly 9,000 new cases today. The country managed to keep the number of infections low at the start of the pandemic. But as DW's Alexandra von Nahmen reports, the government is now facing criticism for failing to prepare the country for a second wave.
In the foothills of the Tatra Mountains, a popular tourist destination. This winter, however, Paweł Szeliga has little hope of much business. Normally, his family's guest house would welcome school classes and other organized tour groups, but most of them have already cancelled.
If we didn't own this place and just rented it, we'd have already given up. No matter what. 100%. The guest house practically generates no income, but still costs money.
With tourist numbers slowly rising again over the summer, Paweł Szeliga was hoping for a situation to improve. But now the region has been declared a red zone due to a surge in COVID-19 cases. And that means additional restrictions, including wearing masks in public spaces and a ban on cultural events. A pharmacy in the center of Zakopane, Poland's most popular mountain resort. Marzena Mitan-Abel has been running it for 24 years.
This has been going on for months now, so people have slowly started getting used to it. But the situation for us here is difficult. As a popular tourist destination, we in Zakopane are more at risk.
During the first wave of the pandemic in the spring, Poland's national conservative government reacted quickly by imposing a lockdown and closing the country's borders for foreign travelers. But since then, the authorities have been facing growing criticism for failing to prepare Poland's health system for a second wave. We visit Marzena Mitan-Abel at home. Her husband, originally from Yorkshire in the UK, contracted the virus in the spring. Fortunately, without severe symptoms. He praises Poland's quick response to the pandemic, but is worried about its hospitals.
The health system in Poland is basically enormously lacking in funding. So if the country becomes overwhelmed, then I think it's going to be a problem because of the number of hospital beds, the number of respirators, the number of medical staff.
Paweł Szeliga is also worried. In addition to his regular job, he organizes weddings. Here in the mountains, they have to be big. But it's almost impossible to plan a wedding, he and his business partners say, if the authorities make ad hoc decisions all the time.
They should have set limits from the beginning. What difference does it make if we have 50 or 100 wedding guests? In a group of 10 people, we're in a small circle. We know each other and we can react quickly if anything happens.
What we need is a clear strategy to combat the pandemic, Paweł Szeliga says. Otherwise, it will be increasingly difficult to convince people to comply with the restrictions.
And here are some of the other coronavirus facts and figures from elsewhere in the world. The World Health Organization warns an additional 10,000 children per month could die from malnutrition due to additional economic strains linked to the pandemic. According to a register of authorized medicines, Russia has approved a second COVID-19 vaccine. And the Chinese city of Qingdao has fired health officials after an outbreak of infections broke a nearly 2-month stretch without new cases. City officials say they are still working to test all 9 million residents after this outbreak.